Alright, this is my presentation on plasma clearance. So today we're going to talk about plasma clearance, what it is, and studies that are being done to go over plasma clearance. So overall, plasma clearance is the clearance of any substance is defined as the volume of the plasma completely cleared out of that substance by the kidneys per minute. And it refers not to the amount of the substance removed, but the volume of the plasma from which that amount was removed. So again, it's defined as the volume of plasma completely cleared of the substance by the kidneys per minute. So this is clearance of the actual plasma of the blood to get rid of ions or water or solutes or anything that is built up in concentration in the blood and in the plasma. Compared to plasma entering the kidneys through the renal arteries, plasma leaving the kidneys through the renal veins lacks the material that were left behind to be eliminated in the urine. So when clearing the plasma, it's going through the kidneys, it's going through filtration, and what is released back into the veins does not have the same ion and solute concentration as that entering the kidneys. By excreting the substances in the urine, the kidneys clean of the clear plasma flowing through them of these substances. So the kidneys then get rid of it through the urine and get rid of that waste products. Plasma clearance is actually a more useful measure than urine excretion. So in the hospitals, it actually has a lot more to do with how patients are doing and how their plasma is looking than just the amount that they're actually excreting. It's more important to know the effect urine excretion has on removing materials from the body fluids than know the volume and composition of the discarded urine. So plasma clearance is actually a lot more important than just excreting urine. Plasma clearance expresses the kidney's effectiveness in removing various substances from the internal fluid environment. So a buildup of sodium, potassium, any kind of byproduct, any extra ions, anything like that. It is able to be calculated. So the calculation, which you see here on the screen, it is the clearance rate of the substance or plasma clearance in milliliters per minute is equal to the urine concentration of the substance times urine formation. Both of those are measured in milliliters per minute, divided by the plasma concentration of the substance. So what it was originally in the plasma before entering the kidneys is how you would calculate that. Plasma clearance results in 4 different methods. So there are 4 different ways that the plasma can actually be cleaned of excess ions. The first one is substance is filtered but not reabsorbed or excreted. The second is filtered and reabsorbed but not excreted. So this would be it's filtered and then put back into the blood. The third one is filtered and secreted. So that would be where it's filtered out and it leaves through the urine. And then 4 is filtered and not secreted but partially absorbed. So this is where it would go back into the body, back into the bloodstream to be used. This could be things such as water, it can be sodium ions, potassium ions, any other kind of ions that need to remain in the body, depending on the homeostasis of the body at that time. The study that I decided to go over for this one is over the single or dual sampling methods for testing plasma clearance in individuals that have kidney disease or kidney failure. This is very important to know how they are doing clearing their plasma as their kidneys are not able to actually filter out all of the ions that they're supposed to. The problem for this study was single sampling methods, which is taking a single sample of the plasma clearance of the kidneys. For glomerular filtration rate, or GFR, are commonly believed not to be precise enough to meet clinical demands. So it's highly believed and highly thought that taking a single sample a few hours after the injection of materials that help to clear out waste in the kidneys is not precise enough to determine if individuals with kidney disease and have an issue with glomerular rate filtration is actually a good measurement to see if their plasma is being cleared at good rates. The experiment for this one was a study to compare the agreement between single and dual plasma sampling methods with a 3-point plasma clearance of ioxol. So the idea was to take individuals both that were healthy and ones with chronic kidney disease and do both single and dual plasma sampling methods with them. Single would partake in taking a sample of their plasma after a certain amount of time after post-injection, where dual plasma sampling would be taking samples at 2 different times on different hours to determine how their plasma clearance was progressing as they had these injections. Their methods was having a total of 46 healthy volunteers and 124 chronic kidney disease patients with varying degrees of renal dysfunction to receive a 5 milliliter ioxyl IV, and plasma samples were drawn at a 2, 3, and 4 hour post-injection. So after they received the ioxyl, they had samples taken of their plasma at different hours to determine whether or not their kidneys were actually clearing out their plasma. So again, 46 healthy individuals, 124 with chronic kidney disease with varying degrees of renal dysfunction were used. Okay, the results were that there was a bias was similar among single plasma sampling methods and dual plasma sampling methods. Looking at the data, again, there was bias among single plasma sampling and dual plasma sampling methods. They were both found to be effective in ensuring that individuals were having their plasma cleared of the ioxyl. The best correlation was obtained from the 2 and 4 hour double plasma technique. So the correspondence correlation coefficient of 0.9988, with none of the estimates differing more than 30% from the reference GFR, and only one, which was actually 0.06% estimate, differed by more than 10%. So taking a sample at hour 2 and hour 4 post-injection was seen to be the best correlation and the most accurate. But in addition to that, single sampling around 3 or 4 hours post-injection demonstrated acceptable accuracy at a GFR level that is less than or equal to 60 milliliters per minute per 1.73 meters squared. So meaning if individuals with kidney disease had a GFR that was less than 60 milliliters per minute, it was better to take single samples from them at hours 3 or 4. However, if individuals had a GFR level that was greater than 60, the double plasma technique was more efficient at hours 2 and hours 4. Here in the chart you can see the median, the IQR of all of these. They break it down, the GFR rate at hours 2 and hours 3, hours 3, 4, 2 and 4, and then they also did single sampling methods at hours 2, 3, and 4 to determine which one was the most efficient. The correlation coefficients that are seen over here on this side, here is where we see that taking it at hour 3 has a high correlation coefficient, meaning that it is very accurate, but we also see here that taking a dual sampling at both hours 2 and 4 had the highest coefficient rate. The second highest, with hours 2 and 3 having the highest coefficient rate seen above. The conclusion from this study showed that 4-hour single sampling method is advantageous in clinical practice in subjects with a GFR that is less than 60 milliliters per minute. For patients with an expected GFR of more than 60 milliliters per minute, a prolonged sampling time is more reliable, meaning that not only are single sampling methods precise enough to meet clinical demands, they were also able to have a better understanding of when it is appropriate to do both of them. So instead of being single versus dual sampling, it was more catered to the patients, determined based off of their GFR level. Again, if a patient has one that's larger than 60 milliliters per minute, doing the dual sampling method is more clinically, it is more precise for clinical demands, whereas dealing with a patient with a GFR of less than 60 milliliters per minute or equal to that, doing the single sampling method is more efficient in ensuring that their plasma clearance is working properly. In this table, you see there are various times that the accuracy was 100%. Again, we see that at the 2 to 3 hour rate. Doing dual sampling methods there is also available here when you see 2 and 4 as well. So again, in a lot of patients, either single or dual sampling is more efficient.